we've got a baby to see. Yes! You guys like babies, right? Hi. So this little one is how many days old? Like 2 weeks, 16 days old. This baby has gained a pound over birth weight in just 14, 15, 16 days. That's an extra ounce a day, which means we've got plenty of milk. This is exclusive breastfeeding, so good job. Yeah. Hi. Oh, you're cute. Yes, you are. Hi there. What you doing? Now, you're only 2 weeks old, so I know you're not going to give me a smile. That would be very amazing. Can you give me my first 2-week-old smile on camera? It's not going to happen, huh? Because I'm all foggy and blurry. I know, right?
Repeat that?
I'm foggy and blurry? Yeah, right. Yeah, okay.
Why is that?
Well, see, newborns see in black and white and shadows. Color has not yet developed, I think, till around a month. Now, I'm winging that a little bit on the month thing, but I know for a fact newborns don't see in color. And their focal point isn't quite yet fixed, so you'll see babies will go cross-eyed sometimes. And that's just because they're trying to focus on this blurry image. Babies particularly like the images of their parents because that's the face they've... Oh, bless you. And the voices, right? Voice of their parents, because they've heard that voice.
Definitely knows me.
Yeah. You got a really cute baby here. All the baby lovers in the world are going to be like, oh, I want one. Let me have one. Bless you again and again. So for our newborn check here, we sort of start at the top. We've got a soft spot that's open and soft. We've got a nice feeling normal looking cute head. Yep, ears are looking perfect. And the eyes look good. I'm gonna go get my tools and look in here, but basically, let me get my light, that'll help a little bit. So since the eyes are open, we're gonna do what's called a red reflex check. So I look through the pupil and I get a little flash of red, and I already did that. Now we also look at the reflection of the light relative to the pupil, and those of you who are watching this on camera, you can see the little reflection. Where did it go? Right now it's centered on the pupil. Those eyes are working together perfectly, and it moves relative to the pupil perfectly. We got perfectly tracking eyes already. Yeah, that's advanced for 2 weeks. Now we're precocious. We're gonna look at the tongue. So babies these days, it feels to me like every baby's tongue is attached a little closer to the front than it used to be maybe 20, 30 years ago, but you see that tongue comes past the lips there. That's fine. And of course, we already know that we've got a champion feeder here, so it's working, everything's working fine. I like to see that the head moves both ways, so you'll see I can tilt to the side and the head looks over the right shoulder. I can tilt back this way, and the head looks over the, come on now, help me out, left shoulder. Ta-da! Good, 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 good. All right, we've already checked heart and lungs. I'm checking hips. I'm going to check pulses while maintaining our modesty, especially on YouTube. All right, femoral pulse is good. When we check hips, we're doing this maneuver and this maneuver. They have fancy names. See if you can put those in the description. Ha, that's a quiz for you medical type people. Now the belly button that you had questions about. I see a little fleck of kind of probably old dried blood.
Well, so I used our baths last night, cleaned it out, and then it comes right back.
It comes right back. Okay. Well, I will clean it out again for you, and we'll see what we're dealing with. I think that's just a fleck of blood, but we'll see when I clean it up. I'll go get a Q-tip. What we've got here is, this is a wet Q-tip I'm using. You can see it's staining red already, so that's just dried blood like I thought. Oh, I'm sorry. I'm sorry. I'm kind of pinning you down, huh? Like, this is the happiest baby in town, and then you go mess with my belly button. That little scab of blood does not want to come off, but it will. It will. Yeah, so blood is kind of irritating to the skin, so you can see a little kind of extra redness right there at the tip of my Q-tip. It's fine. You can soap and water get that last fleck of blood off. I'm going to leave it alone. If it's bleeding after you've cleaned it, you can take a dry Q-tip and actually spin it in there. So you can see I'm sticking it in there and spinning it, and that's not going to cause any harm. It's a dead end, and there's that last fleck. Ha, gotcha.
So it's not bothering her?
Not bothering her at all.
Okay.
No. The last thing, I didn't flip you over, but we got to look at all sides. This is a little normal birthmark. Just about every baby has that one.
Yes.
The stork bite, right? Because that's how the babies come, don't they? The stork brings them, kind of holds them by the back of their neck. Yeah. And we look for a sacral dimple, which is just there, and there's none. So that looks fine. There you go, kiddo. That little hint of yellow on the whites of the eyes, that's the last of the jaundice clearing up. So jaundice, yellow color of the skin, starts at the top of the head, goes down, and then goes away like that. All right? I am done torturing. Folks, a big thumbs up for this amazingly cute baby and wonderful mom. Ta-da! All right, I'm Dr. Paul. Thanks for watching.